One of the most common reasons why you have low back pain is actually because your hips don't work. Hips are super important for the biomechanics of how your spinal column is designed to move around. Your lumbar spine is designed to be stable, and it's not really supposed to move very much, and you need to be able to control that motion so you don't get into positions that compromise your spinal column. And if your spinal column is supposed to be strong and stable, then there are other joints that need to be moving so that you don't end up putting your spine into positions it's not designed to be in. So your hip sockets are designed to move. They're ball and socket joints. They're made to move in all directions. And humans move in 3 planes of motion. So you have forward and back, side to side, and then rotation. Humans don't move in isolated planes. We don't move in purely frontal plane or purely sagittal plane or any of these kind of pure motions. We're not robots. We move in all 3 planes all at the same time, all the time. When you get in your car, you go into all 3 and you rotate into the car. When you load your dishwasher, you grab the dish, rotate, and bend over to put the dish in the dishwasher. And you're using all 3 planes all at the same time. Now, your hip socket is designed to move in all 3 planes all at the same time, whereas your lumbar spine is not. Those joints puzzle piece together very specifically, and if you move improperly, they bang into each other and it hurts. So this is a really simple tool to solve those problems and teach your brain how to use your hip sockets and prevent you from using your lumbar spine. And I'm gonna teach it to you real quick. It's a very simple thing that you can do to train yourself to get used to finding your hips and stop using your low back. So you're gonna take a stick like this. This is a 3-foot dowel. If you don't have a 3-foot dowel, they sell these at pretty much any hardware store for maybe $2 or $3. If you don't wanna go spend $2 or $3, take the head off of an old broom, find your kid's hockey stick, it doesn't matter. Just find a stick that's straight. And you're gonna put this on your back, just like this. Your hand slips into this little pocket right here where your low back makes that little arch, and your hand slips in there so that you can't cheat. And then you're gonna have 3 points of contact on the stick at all times. So I got the back of my head, the middle of my back, and my tailbone on the stick at all times. Now, if I use my spinal column at all, I'm gonna come off of the stick. And this is gonna teach you when you're using your spinal column to do things it's not designed to be doing. So let's go ahead and put it on and I'll give you some examples. If I go to use my neck and my cervical spine, I'm gonna come off the stick. If I use my middle back, again, I come off the stick. If I use my low back and I go to bend forward to pick something up, I don't have to go very far and I'm already off the stick. I am literally just brushing my teeth in the morning and using my lumbar spine because I'm coming off almost immediately. So you don't have to go very far to recruit your lumbar spine. It's not about distance, it's about mechanics. You're not putting that motion into your hip socket and you're using your back right away. So this is gonna show you what activities you should be doing and what activities you should not be doing if you have chronic low back pain, a herniated disc, maybe stenosis, pinched nerve. You don't wanna be irritating that stuff. So patients ask me all the time, what exercises can I be doing? What exercises can I not be doing? And I tell them, listen, there are way too many exercises for me to go over with you. All of the different things that you should be doing and should not be doing. The list would be miles long on what exercises are available to you. So I can't catalog all of them. What I can teach you is a concept. If you put this stick on your back and you attempt the exercise and you come off of the stick, you can't do that exercise. If you have the hip mobility, you got the knee mobility, you got the calf mobility, and your other parts of your body are working properly and you can get into that position without coming off the stick, then you're cleared to do it. If you can't do the activity without coming off the stick, it's a no-go until we fix this problem. So here's how you can train your body to do this. Once you get into this position, what's gonna happen is you're gonna start off using your hip socket. And as you use your hip socket, you're gonna go down and stay on the stick. And suddenly what's gonna happen is your hip is gonna stop working and your hamstrings are gonna get pretty tight and it's gonna start rotating your pelvis down like this. And that's why you're starting to recruit your lumbar spine. So as soon as you come off of that stick, take this tailbone area where your belt line is and just rotate your hips back to get back onto the stick, and that's how you put the motion back into your hip socket. And then you go down a little farther and it happens again, and then you rotate it back, and you can get all the way down to your floor without coming off the stick in forward and back motion. Now that's just one of the 3 planes of motion, and humans don't move in isolated planes, so you very rarely are purely going forward. So you gotta practice all 3. Once you practice going forward and back, then you gotta practice rotation. Ready? I could rotate this way with my back and come off the stick, or I could rotate this way through my hip socket and lean into that hip and not come off the stick. I could also go side to side, and I could come this way and use my back and injure my back. Or I could come this way with my hip sockets and not come off the stick. So if you're going to do an activity like loading your dishwasher, for example, you could go like this. You could bend forward to grab the dish and come off the stick. Then you could rotate over to where your dishwasher is and then lean and come way off of that stick and really hurt your back. Or you could stay in your hip socket the whole time and load your dishwasher without using your spinal column at all. So there are very simple ways to train yourself on how to use ball and socket joints to where you're not using facet joints and disc issues in your lumbar spine, creating more injury. And if you can find your hip sockets, you can get out of pain pretty quick. Everybody keeps telling you that you got a low back problem. I'm gonna submit to you that you actually have a hip problem. If you've got chronic low back pain that you haven't been able to solve yet, I'm gonna make a really easy analogy for you that shows you it's actually not coming from your back and it's coming from something else. You have a mechanical problem. You don't have a degenerative or an injured tissue problem most of the time. So this is a mechanically operating door, okay? We have a hinge, which is gonna be the equivalent of our joint. We have a door, which is gonna be the equivalent of our bone. And then we have the mechanically operating person as me, which is gonna be the equivalent of a muscle that needs to move the door. So the door moves by muscles pulling on it at a hinge, and that's how bones move you around, okay? That's how your body operates in general. So in this mechanically operating door, if everything is working properly, the joint is doing what it needs to do, the bone is doing what it needs to do, and the muscle is doing what it needs to do. Everything lines up. I, as the muscle, don't need a lot of effort to move this door. The door can open and close perfectly fine. It doesn't make any odd noises. There's no squeaks, there's no bangs, there's no cracks. Everything lines up in the frame perfectly fine, and this is a nice, happy door. Now, sometimes what happens is the hinge may not be operating the way that it's designed to, which is going to be the equivalent of our joint. And let's say I went in here with a screw gun or a screwdriver or something, and I unscrewed 2 of these bolts, and I took the whole door and I kicked it on an angle like this. And this hinge is not lined up with the other hinges, and now I have a mechanical problem with this door. That door is not going to line up properly. And I, as the muscle, I now have to try a lot harder to open this door because it's grinding at the joint, right? I can't open it well. I gotta try harder to push it closed because this whole thing is kicked over. But more importantly, this bone is not gonna line up with the other bone. And when the door closes, this little corner is gonna slam into the frame of my door frame, and I'm gonna cause damage here from a problem here. And as you do that, you could patch this up, you could put new paint on it, you could put new plaster on it, you could redo this, refinish it, sand it down. You could buy a whole new door. If you don't solve the mechanical problem at the hinge, this will continue to come back and continue to be a problem. So most of the time, what I find in my low back patients that have chronic pain for 10 years is it's not coming from their back. This is the equivalent of what's called a facet joint in your lumbar spine. That facet joint is becoming damaged because it's slamming into the other facet joint in your back. And the reason is the hip socket is not doing its job. It's not allowing the door to operate the way that it's designed to, and it's banging together somewhere else. So if your hip's not doing its job, your low back will take the brunt of it.